CNA Knowledge Practice Test, Real Exam Questions. Question 1. The Grant family has just lost a loved one. A family member informs you that their culture does not permit a dead person to be left alone before burial. Hospital policy states that all bodies are to be stored in the hospital morgue. How would you best handle this situation? Option A. Gently explain the policy to the family and then implement it. Option B. Notify the nurse about this cultural concern. Option C. Call the deceased patient's primary care provider for advice. Option D. Move the deceased patient to an empty room and stay with the body yourself. The correct answer is option B. Notify the nurse about this cultural concern. We must respect and uphold the cultural needs of our patients. You must immediately notify the nurse about this cultural need. It is possible that the nurse can accommodate the wishes of the family. Question 2. A CNA is caring for a patient on hospice care. She notices the patient's lips, hands and feet are blue and mottled. There is no rise and fall of the patient's chest. What should the CNA's next action be? Option A. Start chest compressions. Option B. Call 911. Option C. Shout at the patient to wake up. Option D. Notify the nurse. The correct answer is option D. Notify the nurse. The CNA should notify the nurse to come assess the patient. Because this patient is on hospice, the nurse will then notify the doctor if the patient does not have a heartbeat. No interventions will be attempted as the patient is on hospice care. A patient on hospice care would be considered DNR, or do not resuscitate. Therefore, chest compressions or calling 911 would not be appropriate as this patient is deceased and does not want further intervention. Because there is no rise and fall of the breath, it would be more appropriate to check for a pulse or notify the nurse that the patient appears to be deceased. Shouting at the patient would not be appropriate. Question 3. Which of the following hospice tasks should not be performed by a CNA? Option A. Taking vital signs as requested for the family. Option B. Providing repositioning and perinatal care for the patient. Option C. Providing emotional support for the family. Option D. Determining time of death for the family. The correct answer is option D. Determining time of death for the family. A CNA should leave the determination of time of death up to the nurse to report to the physician. A CNA can report a suspected patient condition to the nurse. A CNA can provide physical and emotional care for the patient and family during a hospice encounter, as well as making legal records of vital signs and care for the patient.